How does the CORT scan imaging protocol diagnose stomach cancer? Imagine trying to see inside the body without making any cuts. That's what a computed tomography scan does. When doctors suspect stomach cancer, they use a CORT scan to get detailed pictures of the stomach and nearby organs. This process begins with the patient drinking water or a special contrast agent before the scan. This helps to expand the stomach, making the walls and any abnormal growths easier to see clearly. The contrast agent also highlights blood vessels and tissues, making tumors stand out more distinctly. Once the stomach is prepared, the patient lies on the scanning table, usually on their back or stomach, depending on what the doctor needs to see best. The CORT scanner then takes multiple thin slices of the stomach area using advanced detectors. These slices are like very detailed cross-sections that can be reconstructed into three-dimensional images. This high-resolution imaging allows doctors to see how deep the tumor has invaded the stomach wall and whether it has spread to nearby lymph nodes or other tissues. To improve the clarity of the images, intravenous contrast is injected into a vein during the scan. This contrast makes blood vessels and tumor tissue more visible, especially in different phases of the scan. Multiple phases help distinguish between normal tissue and cancerous areas, providing a clearer picture of the tumor's size and extent. The images are carefully analyzed to determine the stage of the cancer. This includes assessing how deeply the tumor penetrates the stomach wall and whether lymph nodes are involved. The accuracy of this staging can be quite high, often around 78 to 90%, depending on the specific case. Sometimes, the CORT scan also guides needle biopsies, where a small tissue sample is taken from suspicious areas outside the stomach for laboratory testing. This helps confirm whether the abnormal tissue is cancerous. In addition, the CORT scan looks at other organs like the liver, lungs, and the lining of the abdomen to check for metastases or spread of the cancer. This comprehensive view helps doctors plan the best treatment approach. It is important to remember that while CORT scans provide vital information, they are part of a larger diagnostic process. Confirming stomach cancer usually requires a tissue biopsy, often done with endoscopy. In summary, the CORT scan protocol for stomach cancer involves preparing the stomach with contrast, using advanced imaging technology to produce detailed cross-sectional images, and analyzing these images to determine the tumor's size, location, and spread. This detailed information is essential for accurate staging and guiding treatment decisions. Always consult healthcare professionals for personalized diagnosis and care, as each case can vary.